We're going to be going on like, oh, I'm sorry. Oh, hi, everyone. Good afternoon, good evening, good morning, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinto. I'm the CEO and co-founder of Living Spring Family Medical Center here in the now hot city of Mansfield, Texas, not too far from Dallas. And here we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And so we're having conversations today on the topic, how can I decrease joint pain without meds? And I am honored to have not only a fellow alumni, like former classmate of mine, schoolmate of mine, but also a physician who is not just a physician, but physician at heart, Dr. Janice Brown. How are you doing, Doc?
I am okay, Dr. Tolu. Um, so thank you again for having me on. And so I guess I'll start just with a little bit of a background. As you mentioned, we went to the same medical school together. And I actually decided to major in physical medicine and rehab.
Hmm.
And after that, I actually did a certification in medical acupuncture. And after that, functional medicine. Then I also did certification in life coaching.
Mm.
So
Yeah.
lifelong learning.
I love your journey, and I love what you do and how you like to help people improve their quality and quantity of life. That resonated with me reading your bio. Now, for those who are watching live, hashtag live. Those who are watching replay, hashtag replay. For those who have friends on Facebook who are watching right now who should watch, just tag them in the comments and share as well. But Doc, please, why do you do what you do? That's my question. Why do
Um,
you do what you do?
I do what I do because of several things. I believe in a natural approach to health. And I think that's just from me growing up in the Caribbean. I'm from St. Croix. Combined with wanting to see people get better. And that's one of the reasons why I went into PM&R, physical medicine rehab, because you study a lot of the musculoskeletal system, the nervous system, and find ways to improve people's function. I've sort of transitioned that, and now basically what I do is I help people mainly with a lot of like muscle pain, joint pain, back pain. I help them not just by giving opioids, but also expanding the horizon and using other tools available to help them with, manage their pain. So I just like to see people, just like any doctor who goes to medical school, we all want to see people get better. I think for me with PM&R, we get to see them get better a little bit quicker.
I see. I like that you like right then and there you're able to see them actually get better, and that's
Yeah.
rewarding itself. Uh,
Mhm.
all right, touche. Now you talked a lot about pain, and I know you have so many angles to you, but today we're kind of talking more about how to naturally ease a joint pain. But
Mhm.
what are common causes of joint pain that you tend to see at your practice or your line of work?
So obviously it's the osteoarthritis, which is the wear and tear,
Hmm.
and that's just people actually breaking down their joints. But one of the things about that type of arthritis or degeneration in the joint is that to some extent it can be prevented, and the way to prevent it is actually by supporting and making sure that the muscle surrounding the joint that actually helps to move that joint is strong and allows the joint to maintain its function, because a lot of people are weak, they have weak muscles. Best example is like the knee joint. That's one of the joints that breaks down pretty quickly. But if somebody maintains the integrity and the strength of the quadriceps, which is the muscles on the front of the thigh, and balance it and make sure that they also have, strength in the hamstrings, which is at the back of the leg, and also the side. So that we sometimes forget about the side and the middle muscles. That creates a nice balance to allow people to just be able to like maintain that joint. So that's one type that I see. Of course, I see in my practice I have a lot of three rheumatologists that actually are in the practice, so they're also seeing a lot of the arthritis that are caused by inflammatory processes, as well as people who have processes where they're um, sort of like their immune system attacks the lining of the joint, or at least of the bone that creates the joint. So autoimmune disorders, they will see those. So sometimes they'll send them my way, especially if they can't get their pain controlled with what they use. And so I will employ different tactics. I do a lot with back pain, and I think back pain is a big I wouldn't say problem, but it's common
Very common.
across not just the United States, but actually it's across the world.
Oh, yes.
Believe it or not. And so with back pain, people sometimes forget that we have these tiny joints in our backs, especially in the low back where we move and we can bend forward, and in the neck. So I see a lot of those, and pretty much help them to ease the pain using, whether it's injections. Sometimes I'll do, medications. I do acupuncture. But the one thing that I think is key is looking at people's weight and what they're eating. And sometimes we forget about those two things.
Okay. All right. So you've touched on the topic, and that kind of segues to my next question. So you have someone, and sometimes I see this at the clinic. Patient comes
There's
in.
a little bit of it seems a little bit. Do you hear your voice because it's breaking up a little bit?
You're echoing. I'm echoing. Am I echoing?
It's still kind of wonky, like kind of, it's almost like the voice is coming through and it's being interrupted.
My Wi-Fi looks really strong here.
Okay.
I'm not sure.
Okay. Well, we can go on. I'm not sure if it's maybe on my end, but
You sound good. So you sound good. All right. So my next question is: sometimes you have patients who come in, and they say, well, yes, I know weight loss can help with joint pain, but when I move, it hurts.
So totally, it's a little bit hard to hear.
Okay.
You didn't change anything?
Nope.
Okay. Oh, all right. I'm wondering if it's my connection. Maybe, yeah. All right. So so what I'll do is I'll just go ahead. I know that you're asking some questions, and I'll just kind of
I'm gonna chat with you. So look at the screen and look in the chat in the yes.
That's good.
All right. So my next question is is weight loss can help with joint pain, but what would you say to someone when they say that movement hurts? How would you encourage them to keep going?
I know that's a tough one. So because it's it's a catch-22, and a lot of times, weight loss, there's way more to losing weight than just simply saying, hey, just go ahead and lose the weight. A lot of times they get frustrated because they don't know how to. But essentially, what I tell people who are, having joint pain and they're complaining and they say they can't move, I explore with them what they can do. What movements can they do? And I'm here in Central Florida, so there's a lot of access to pools. One of the major hospital systems here in the city that I live in, actually has access to a heated pool that's indoors. And sometimes I'll have people. I'll actually write a prescription for PT, but specific for aquatic therapy, just to get them in the water, because the water is so great that it supports the joints, it supports the body, so you don't get that strain through, all the weight going through the joints, in the spine, in the hips, the knees, the ankles, the feet. So I try to get them to do some of that activity. If they're pretty much resistant to that, I say, okay, if you taking a pain medication, try to optimize when you take your pain medication, that's when you do your activity, and some type of activity. And it could just be simply hey, let me just walk to the mailbox and check the mail. It could be, hey, I'm going to go shopping, food shopping, you know, anything that gets them up and moving. Because there's a catch-22, when those joints get like kind of, they get into a position where it's hard to move smoothly, whether because it's, the surface of the bone is breaking down, or like in the back, those, we call them facet joints, where they get kind of, irregular and kind of, they grind against each other. And so every time that they move, it generates the pain. It's a catch-22. They got to move it so that way they can maintain that sort of oil. I wouldn't. It's not actually oil, but it's a lubricant that is in each
Yeah.
and every joint. So they have to move to be able to maintain that, and to create or to keep the joints kind of mobile. So I find creative ways, and it really depends on the person. I mean, I individualize my approach to dealing with them. So one person may say, I hate the water. Okay, well, let's go back to the drawing board and let's figure out what you can do.
Okay. All right. That's good. Interestingly enough, today I had a meeting with a physical therapy center owner, and he has aquatic therapy, and there's not too much of it here in Mansfield or in Texas area for whatever reason. But um, my patients have found it very useful, so I like that you mentioned that. But my next question to you is this: if you can hear me,
I can hear you good.
all right. So for someone who's a couch potato,
Uh-huh.
and sorry, I hope that no one's offended by that comment. Like meaning you just enjoy the couch. You seem like just staying still is helpful,
Mhm.
comfortable for you. How would you encourage them to start? Because I know you said going to the mail, but what if I don't check the mail? I don't expect a mail from anybody. Or grocery shopping. I don't like grocery shopping. I've gotten used to ordering stuff since COVID. How would you encourage them to start? Because I know you said it's a catch-22, so it's
Yeah,
almost intuitive. Like it hurts when I move, so why would you move? But we know that if you don't move, the pain gets worse.
right.
So how would you encourage them, Doc? What would you
So
say?
that's why I kind of put on my life coaching hat and start working with what it is that motivates them, because for most people there's something that motivates them. So, it could be, hey, I want to be able to see my grandchildren, graduate, or my grandchild graduate. So I start there and I say, okay, what is your motivation? Then I try to find out what it is that keeps them or has kept them from moving. So a lot of times there could be some depression, because we can't not think about that. Oftentimes people who have chronic pain, there's also, some sort of depression or anxiety associated in conjunction with the pain. And so I try to find out, okay, if there is some type of depression, or is the depression being treated? Because a lot of times if you don't have the will or the desire to move or to do anything, you're not going to,
Okay.
right? So, that's where the family medicine folks come in, like to be able to, talk with, their patients and find out, hey, you know, are they being treated for depression? Can we get them on something if that's the case? So I look at their motivation and I check out to see whether or not they have depression or anxiety. Um, then the next step would be to find out, something that they like to do,
Okay.
something that they enjoy. Can I pair an activity with something that they enjoy? So in other words, it's kind of like they know they need to do something, but yet they know there's something that they like to do. And
Okay.
I'm gonna see if, hey, maybe I can pair it. And it could be something as simple as, hey, I enjoy watching TV. Okay. So if you enjoy watching TV, right, can you get one of those bikes, those stationary bikes, the ones that you can actually put on the floor, not the whole bike, but can you start there and say that every time that you sit down to watch a show, that's what you're going to do? You're going to pedal, or do some kind of activity. For those who are a little bit more mobile, hey, can you say every time that you are watching a show or you're doing something that you enjoy, can you pair it with an activity? So that's kind of where I would go the next time around. And then, if they give me resistance, I just keep at it. Every time I'm relentless. Every time I see them, I say, okay, hey, so are you getting active? Are you getting moving? Okay, so what are some of the things that you're doing? If that doesn't work, I also will target something that's an easy, sort of like a low-lying fruit, if you want to think of it that way, something that they can change easily. So movement may not be something that they're readily available, but they may say, hey, I do want to eat better, right? Okay, so then let's target the food choices and the diet. Let's see if we can start there. So most people, I would say, have a motivation or something that drives them to want to feel better. There's not a lot of people who enjoy feeling better. They may seem as though they want to kind of just stay where they're at, but if you dig a little bit deeper, there may be fear that's holding them back from moving forward because maybe something failed. They failed a particular therapy. They didn't do well. They had a bad outcome or a bad side effect from something they tried. So I dig a little bit deeper to really find out like kind of what's going on and what's preventing them from actually doing what they're supposed to do. Or not supposed to do, but would be beneficial for them.
Yes. Yes. I like how you word how you reworded that.
I have to be careful what I say because I mean, like, the goal is not to offend anybody. It's not like telling you, oh, you have to. There's nobody that I tell my patients, I say, listen, just because I make a recommendation for something doesn't mean that you have to do it.
Right. It's your choice, your body.
Ultimately, it's your decision. I'm only making suggestion. The only thing I can think of is if you come to me, that means that you're looking for some type of solution.
Right.
And you're seeking solutions. So I'm here to help you find that solution.
And one of the things I can just garner in just talking to you is that you don't give up on patients. So there's something that can be done to improve the quality of life. And sometimes it needs more encouragement, needs to kind of tease out some fears or known to them and sometimes not known to them as well in discussion to help them reach their goals. I want to touch on one more thing that you do, though. You do acupuncture.
Yes.
Right? When would you recommend and of course, we know these are medical suggestions. We do encourage them to kind of make an appointment with their own doctors to come up with a plan that's good for them. But when would you suggest acupuncture? Is there a time you do it? Like who would you recommend this for?
Typically, I recommend acupuncture for people who have a lot of sensitivity to medications. They don't do well, and a lot of times the older population they don't do well with a lot of the stronger pain medication. It causes them to have dizziness. They're at increased risk for falls. So I typically would recommend those population, the older population, or anybody who's not very tolerant of medications to try acupuncture. The other sort of criteria that I look at is whether or not they have an actual structural problem in their musculoskeletal system. When I say structural, meaning that I can look at it, I can see it on imaging and say, oh no, this is something that needs to be corrected. This is a surgical procedure. This is something that needs to be done. So for example, stenosis, spinal stenosis. So, the hole through which the spinal cord passes, that can be tight for a number of different reasons that I'm not going to go into right now. However, that I consider a structural problem. So if somebody has that and they have symptoms, meaning that they can barely stand up, they're having a lot of like sharp pain that goes down into the legs. There may even be having like bowel or bladder issues. I tell them, look, that's a surgical problem. That's not something that acupuncture is going to help, because acupuncture does not change the structure of anything. What it does is it helps to regulate and modulate, meaning change the responsive nervous system, the conduction of those nerves and how we interpret pain. It affects that. So the people that would benefit really well with acupuncture, those who may have the arthritis in the back, right? They may have arthritis of other joints, but nothing structurally wrong that needs a surgical intervention.
Okay.
People who have a lot of muscle pain, because that is something that's very common.
Okay.
People come in and they say, hey, I have, pain as soon as you touch the muscle. It may have what we call trigger points,
Yeah.
tight areas, tight bands of muscles, tight areas, I would say, of the fascia. That's when you touch the muscle, it hurts. So those people I would, highly recommend, for acupuncture. And then of course, migraines, if they're having migraine headaches, a lot of migraine headache people, like anyone with that, they typically will do well with acupuncture. And then also to those people who, they may be having some GI issues. I will see them for that as well, because sometimes, if you have pain in the abdomen, that can refer pain elsewhere and can sometimes cause pain to be felt in, like, muscles and in other areas of the body. So yeah, pretty much, you know, I tell people, like, anybody can really try it. I've had people who do have like structural issues. I've had a couple of patients who had arthritis. So
Uh-huh.
this is degenerative arthritis in the hip. And they didn't want to do surgery. They knew they needed surgery, but they were trying to wait a little bit longer before they proceeded for surgery for whatever reason. And so I did acupuncture for them, and it relieved their symptoms. The symptoms would be less, I would say, for about a week, and then of course it would come back because, again, they had that issue that in the structure of the joint that needed to be corrected. And when they were ready to do their surgery, they went on and they did well.
So there are options.
Oh yeah.
Medication, non-surgical. Um,
Mm-hmm.
very good. This is good. I'm glad that you offer other options than the typicals. And I'm sure I have someone who's watching who's like, wow, I like this doctor. I know people in the Florida area. Doc, where can people connect with you to either have you come speak on their platform or to kind of work with you? Where can people find you, Doc?
So they can reach me at my website. I have a website. It's called betterhealthlifecoaching.com. And you can also reach me on Facebook at the same handle. So Better Health Life Coaching. And my email is just Janice, Janice, at betterhealthlifecoaching.com. So everything is spelled out. It's kind of long, but hopefully people remember Better Health Life Coaching.
Better Health. I'm going to put a post right here so that way you have access to it. Better Health. I should have put a little space in between, but
Mm-hmm.
Better Health Life Coaching, and that's the Facebook, page. Better
Mm-hmm.
Health and Rehab. I like on the website as well. I like what you do, Doc, and it's really nice to see you doing the things.
Mm-hmm.
Thank you for coming. I appreciate you for taking the time to do this with our viewers.
Absolutely. And we haven't even touched a lot of things that we
I
even
know.
go over the foods that people can avoid to prevent joint pain, but that's a whole nother topic.
Okay, yeah, okay, wait. But that's gold though. So
Okay.
food. So give me three.
So the three top foods that I usually tell people to be aware of that could possibly cause joint pain is gluten,
Ah,
because it can cause an inflammation. Dairy, also the same kind of thought process in terms of causing inflammation. And for some people, it's the what they call the nightshades. So the ones, tomatoes, peppers, and so forth. Sometimes it can cause like an inflammatory response, and that can be uh, seen in the joints. So those are the ones that I typically, and of course everybody's different because everybody has like certain food allergies. Some people it's meats, but those are the three top ones. Some people can't tolerate nuts,
okay.
believe it or not.
Thing.
And so, yeah, it is quite interesting because I've had people, their pain goes away by simply stopping certain food items that they didn't even know that they were allergic to, or like they had a sensitivity to. And it's not necessarily an allergy, it's just that their bodies respond. by an inflammatory response, meaning your immune system is sort of saying, hey, I don't like this in my body. Let's get rid of this. And so the immune system goes up and tries to remove it. And then that's what causes a lot of the issues.
Huh. That's
Huh.
a very good one. Yes, that's a good one.
Yeah.
It's a good one to know. So that would
Mhm.
say, you know what, and sometimes people have to almost like do a self allergy
Mhm.
test, right, where you take out certain foods and see.
Yeah.
I'm
Mhm.
thinking of taking out sugar, like processed foods, limit those and see first.
No, that's a big one. And then of course you got your gout patients too.
Mhm.
And they can, they know that they have to avoid certain foods, the ones that has the purines in it. So yeah, beer, alcohol, shrimp, shellfish, they have to avoid those things. So, because we didn't even talk about gout, that's what I'm saying. It's just like this mountain. We could just go on and on
Honestly,
when we talk about like what causes joint pain.
I'm trying to type it here. Food can be a source of joint pain. Okay.
Mm-hmm.
All right. We're going to do a part two.
Okay.
Um, so because usually the time goes by quickly, so that's not unusual. But we'll
Yeah.
do a part two where we talk about how I can use foods
Mm-hmm.
my joint pain. So we could do that maybe in a couple of months. So this is good, and
Sure.
you've
Yeah.
agreed to live live, so we're good. But thank you so much for coming. This was very rich,
Absolutely. Yes.
and I'm hoping that and I'm trusting that those who are watching live replay, you forward to those who could use this, who will find this useful, and of course share Dr. Janice's information as well with them. Okay, thank
All
you so
right.
much, Doc. I appreciate you. Um,
Welcome.
And then for those of you who watch live, those who watch on replay, thank you for joining. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician that helps you live long and well, and has conversations in line with that, I am she. Have a good one, everyone. Thanks.
Mhm.